is Jessica DeMassa with WTF Health. I am here at HIMSS and Health 2.0 Europe, and joining me right now I have Shane Fitch. She is the managing director for a foundation, a patient-run foundation called Lovexair. And tell me a little bit about what you guys are doing, because it's interesting to me you guys have evolved into not only being a patient organization, but into developing your own application that helps patients connect better with their providers. So talk to me a little bit about what this is.
Well, 10 years ago we decided from a patient organization perspective that we could be much more active stakeholders in developing resources, not just for patients, but for the new era of healthcare professional who needs more digital support in helping to manage particularly chronic diseases. Respiratory disease, as you know, is the third leading cause of death in the world and growing. It's having severe impact on society all across the world. So we wanted to develop a care program which was simple to help educate patients in real self-care, but also provided relevant clinical and patient-reported outcomes to their multidisciplinary care teams. So we engaged particularly with healthcare professionals such as physiotherapists and nurses who want to train and learn how to be educators for patients with chronic respiratory disease. And in the program we include a high content on physical activity, which is good for all chronic disease, as we know, and we can use it even as a clinical study tool, so we could do ongoing follow-up of patient progress. They're getting their feedback from their educator, they're guided, and they feel much more confident. And last year we put the service model to the test in 3 hospitals in Madrid, and we had excellent results on adherence even with very old people. There were 69 with COPD, gold 3 and 4, and a third of them oxygen users. And their perception was very positive about the service. So we went on to design a platform application, which we're hoping to launch at the end of this month as an improved model with different interfaces for the different stakeholders who engage.
That's fantastic, and I want to just 2 things I want to deep dive in on. So before we talk about what the application actually does, I do want to get some advice from you for other patient-led organizations that are looking to get into this arena, because I think there are very many of them. They're obviously very committed to making the patient experience better, because it is usually the patient or the caregiver or the family that is involved. What is your advice to these organizations when it comes to something like this? Are you glad that you undertook developing an app, or are you like, oh my God, I wish we never had even tried? It's a massive undertaking.
It's been a massive undertaking. It's a huge challenge, first of all, because you really have to gen up and come up to date on IT and all aspects of IT, for data management. Now we have the data privacy issues, which are very high profile. We have, of course, the machine learning, the augmented intelligence, which we could be able to use in the future, but we want patients to understand why we would use that technology and how it could help to improve their treatments or their outcomes. But even just moving our society, if you like, to becoming much more digitally health literate, not digitally literate, because as we know, there's a massive uptake worldwide in particularly mobile phones and countries which are soaring ahead in Asia and Latin America because they're their main resources. But developing a program and designing it really takes a lot of careful consideration, particularly when you want the user experience to be relevant to them. Otherwise, you get no engagement. So you really do have to learn a lot about this.
What was the most challenging part for you? Was it dealing with the providers? Was it understanding the IT? What would you say?
I think the co-creation is one of the key areas we've worked on. So we've engaged with a lot of professionals, be it from gaming, be it from clinical expertise, the pathology that we've worked on, the kind of metrics that we want involved, high-level physiotherapists who work in research in activity. It's challenging to keep everybody on board and in a sensible time frame. And also making it a cost-effective model. That is essential, because what we want to do is make it as affordable as a Netflix account or a Dropbox account, but still have very high clinical relevance for patients, which is what they have been demanding for a long time. They want their healthcare professional to share these new tools, the kind of data that they can produce from new tools. So we want to make sure that we can achieve that.
What's your best piece of advice for maybe another patient organization that decides to take this on? Something you wish you had known before you started?
you need to do a lot of work and get a lot of advice from all sectors and be very determined.
Okay. Now tell me just real quick about the application itself, so that if anybody is interested in signing on and using this, what exactly does it help you do?
Well, we've designed the protocol for a self-care program for chronic respiratory disease. We started off with COPD, but we are already migrating out to other respiratory diseases, including rare diseases such as alpha-1. So the patient user can begin to do a daily check on their symptoms, on their lung care, on their activity, perhaps about 10 to 12 metrics. It takes 2 to 3 minutes to fill out. And they begin to get data back on their progress through little graphs and positive. You're making positive progress from your educator, so carry on, So it is very much maintaining the incentive to people to keep engaged. Then they can feel that they can also participate in research in the future when they're well informed about the kind of research that they could get involved in. For the healthcare professional, they're learning about patient activity in a completely different way. So we do have an alert panel and we have an adherence panel. So we're using adherence measurement as a main tool to see how our patients are doing. And I think it's quite a good barometer because that's really one of the key areas that all healthcare systems need to work on, whether it be adherence to self-care or medication. So I think in the future that's going to be a positive way to go for data care.
Now, is the application available for others to use outside of Europe? So if anybody is interested in the States and wants to get on, where can they find out more information?
Well, we've got the platform developed in English and Spanish at the moment, and we're going live at the end of June. We've got a demo available now, so if anybody's interested to see how it works, we're also going to let people use it for a month. So we're very happy to test with organizations, patient organizations, clinics, or even healthcare professionals or physiotherapists that have their own practice and small numbers of patients. So we're really two-tracking this, B2B and B2B2C, and end users.
Fantastic. So it's Lovexair, and I spell it for me so that everybody who needs to go to the website can find this, because you've got a different spelling.
It's Lovex Air, A-I-R.
Perfect. Well, thank you so much for joining us. It was a pleasure to speak with you. I'm really inspired by the fact that as a patient organization, you've taken this on, and kudos to you. Good luck.
Thank you, Jessica.
Thank you so much. This is Jessica DeMassa with WTF Health. Thanks so much for joining us.